this Champion Health is all about catching some of these early stages. But what exactly is Champion Health? So it is a self-funded, first of all, it's an employer-owned, self-funded, self-insured, limited schedule of benefits. In other words, we're not trying to take away your Blue Cross, Blue Shield, Cigna, Aetna, United Healthcare, any of that. That stays in place. So Champion Health stands as a sentinel in front of your current health plan and will offset quite a few of those costs that you may have with BCBS or some of the others. Let me ask, can you hear me okay? Is any problems?
Sounds
I see
good.
everybody.
Yes.
Okay, all right.
Yes.
Okay, no worries. So we use, and it was mentioned that we use a 125 platform, which is very similar to your flexible spend, your health savings, or a 401k to provide these benefits to your employees. And that is also one of the ways that we're able to, one, do this preventive health and also give your employees a little bit of a bump up in pay. I like to say that we engage, educate, monitor, and manage. Well, what do we mean by that? We engage your employees on their smart device. You're going to see in this presentation screenshots of a droid, Android, but this is how we engage your employees, either on the computer, their laptop, desktop, smartphone, whatever. And by education, this is how we're able to hopefully catch early stage indications. We provide information very specific to your employee towards their health. And by monitoring, I don't mean that we put a chip in their neck, but what we are able to do when they're on their smart device, we know when they access it, and we also, more importantly, know when they do not. So all of those things we feel we are able to educate, engage, and monitor your employees. Now, these are just some of the companies that we work with. I'm sure you recognize quite a few of them. Me personally, it was Harley Davidson. McKinley is one of the largest paper companies out on the planet. We even have franchises like Piggly Wiggly. That used to be out of South Carolina many, many years ago, but still has a few franchises out there. And folks, if at any time you have a question, please unmute yourself and just ask away. Be happy to address them. All right, so first things first. Yeah, Champ, we designed this, again, not to replace, because I mentioned these are a limited schedule of benefits. In the next slide, I'll actually show you what those benefits are. But by being a complement to that plan, it just gives you the ability, you, the employer, the ability to add one more benefit for your employees. It's kind of interesting. At my age, when I was coming along, starting my first job and career, I never asked, hey, what am I getting paid and what are my benefits? Well, apparently today that whole system has changed. And now young kids coming in, that's the first thing they ask. So with Champ now as the employer, you're able to add one more layer of additional benefit and pay for your employees. So let's take a look at what the actual benefits are. So primary care and urgent care, we take care of that copay. I've got a client here in town that's a law firm. That was one of the things they were interested in. They were paying about a $30, $40 copay. We picked that up. What is really unique is that if you as an employer have a self-funded, as opposed to a fully insured, a self-funded plan, being that you're actually paying out of a claims bucket, the difference to the primary care and urgent care, we pick up 100% of that office visit. And that can be very significant in addition to what Champ will save the company in FICA taxes, as well as that employee bump up. We do the 100% preventive care. Now, these two are just for the employee. We take it one step further. With your family, we do the unlimited prescriptions. We also have this primary care, and we all know how important over the last 3-4 years teledoc has been. And so we have one of the top of the line Champion Health direct primary care. It's like having a doctor in the family. one of my clients here in town, they just rave about this because she said, we've used telemedicine before. Seldom, if ever, do we actually get to talk with a provider, doctor, physician. And we've got it such that, yeah, you pick up the phone and boom, you're talking to your provider. It's kind of interesting. And these are just some of the benefits within that telemedicine right here. Mental health. The children's home that I was mentioning, a couple of their employees, this is, I don't know if they were doing anger management or what it was, but now rather than to leave your workplace, you just pick up the phone and talk to a provider. Maybe you're doing some stress management issues. I'm not sure, but all of these are covered under that primary care, direct primary care. Dr. Griner mentioned this veterinary thing, and I got to tell you, when I heard about this a couple of months ago, I kind of shook my head and said, really? Well, if you were in my family, my wife has 2 horses, 2 dogs, and 2 cats. And I guarantee you, she spends more money on those animals than on her own health. So this is very interesting that we've added this little benefit as well as the Champ Shield to help employees and employers if they have problems within the workforce. So what are we actually trying to do at Champ with our proactive medicine? We're trying to drive down those hospital costs, the diagnoses costs, and just get everybody in a little bit better health. Champ uses GE Health and Intel to hone in individually to an employee. The program is not sort of a shotgun approach. It is very specific to the individual employee. So let's say, for instance, let's take me, for instance. So yeah, I've got a little spinal stenosis. So rather than the app telling me, hey, Dwayne, you got to run up and down stairs or lift a lot of weights. No, I'm not doing that. So it gave me a very simple, sit on the floor, cross your leg, twist your back very slightly, exercises to help relieve some of that pain. So within our application, it is very targeted to that individual employee. Well, how do we know that? We know that because on a monthly basis, not daily or weekly, an employee goes on the Champ app. We ask some initial questions up front. We do not take blood. We don't send a nurse out there. It's not that complicated. But our app, because of the way it's set up, gets to know that employee on a very individual basis. And over time, we like to say we gently nudge an employee towards better health. This is not something that's going to happen over the course of a couple of weeks, months, but just gently over time, we're going to improve that employee's health. And we all know that if we're able to improve an employee's health, it's going to do 2 things. One, it's going to keep your employee at work, but more importantly than that, it is going to help us drive down that healthcare cost that is just absolutely killing America right now. I'm sure that all of you know what CPT codes are, current procedural terminology. This is what Champion Health uses, the same CPT codes that primary care, specialty doctors use between the insurance company and the provider to get paid. This is how we're able to put money back into an employee's paycheck. So let me kind of get to what I call just the meat and potatoes of it. This side-by-side comparison, and we can do this either on a monthly, semi-monthly, weekly basis. I just happen to pick monthly because it's kind of easy. But you see on the left-hand side, this is an employee making about $2,500 a month, and he's actually bringing home $3,240. After he pays his taxes, he does have a couple of major medical premiums and a 401k. So let's put that employee on Champ. So we've got a $1,200 pre-tax carve out right here on a monthly basis. But because that employee accesses our application, we're able to put $1,010 back into that paycheck. But it does more than that. So initially, yes, that employee is going to have a reduced tax responsibility. Doesn't affect his gross pay, just affects his taxes that he's paid in or is being taken out. When we put that 1010 back in, combined with that lowering of his tax responsibility, this particular employee is now bringing home $33.63. Significant amount of money increase over a monthly period. But what does it do for the employer? And let me see if I can minimize that. So with that $1,200, we know that companies are paying that 7.65 FICA payroll percentage. So initially, there is a $91.80 savings net to the company, or gross to the company. We do at Champion Health, we do have to pay, or rather charge, a $44 service fee. There is no such thing in the world as a free lunch. But after the company pays $44 per employee per month, that company is still left with a $47.80 FICA savings. FICA savings. So I said it was a self-funded, self-insured. So the company is paying $44, but still has a net $47.80 to pay for the company, or I mean, as far as their savings. The employee, the difference here between the $1,200 and the $1,010, that is being paid by the employee. That's where the self-funded, actually the employee is probably paying the bulk of this benefit. But at the end of the day, this particular employee is bringing home $123 more in his take-home pay. He's paid the premium. The company has paid the $44, and they still have money left over. So that pretty much is Champion Health in a nutshell.